Good morning, Patrick here from Complete Health. I just wanted to go through something because it's super common that most people understand that chiropractors will move and in a lot of cases crack joints. And this is something that I'll have patients come to me with the fear that we're going to have to crack and move a joint. Now, let me just stop people and allow them to understand that chiropractic has now been around for 120, I think it's 125, it's either 125 or 126 years, I can't remember because I haven't been in circles with my friends this year, so I can't exactly remember, but it's around 125 years. And during that time, we have developed techniques so that we do not always have to crack joints like people might expect. So a lot of people come to chiropractors because they know that's one of the tools or techniques that we can use. However, there are a multitude of different types of adjustments so that people that are scared of having their joints cracked will come and still be able to get some relief from their problems. So let me explain. I used to have a patient who would freak out, absolutely freak out if you ever made a joint go pop, even when you didn't intend for it to do it. So for example, we may be mobilizing down the spine, or we may be checking down the spine and just seeing what types of things were going on with her spine. And occasionally, just in the process of actually touching and moving, a joint would click and she would freak out. So in those kinds of scenarios, I didn't have any choice but to find alternatives for her. And this is the thing, right, is that there are probably over 100 different techniques within chiropractic. And within those techniques, we go from anything from a super light touch or like a flick, and I've put some of the different types of techniques in the description. So if you ever feel like looking up some of the different types of things that can be done, then you can actually have a look at some of the videos on YouTube and actually find the different styles of adjustments that are actually available. But some of the different types of adjustments that I will use with my patients, things like toggle. Toggle is a super light adjustment where you would just literally use the side of the hand over the top of the joint and it's like a flick. And in the time that you've actually moved or touched the joint, you're almost off it as quick as possible. The point of the adjustment is it needs to be fast, not hard. It needs to be fast, not hard. And when you move a joint fast enough, it doesn't necessarily have to pop in order for you to get the benefit of the adjustment. Other options may be as simple as something like this, an activator, or a lot of my patients will call it the click pen. You can see it creates an impulse exactly the same as a lot of the other adjustments will do. But the point is it needs to be fast. Now the reason we need to be fast is that there are sensory endings within the joint capsules that will respond to the sudden stretch that will send a neurological signal up the spinal cord and almost force the brain to make an adaptation. And some of the processes of what we think are happening is that this process helps to inhibit the pain gates within the brain, thus bringing down pain sensation. It will change the way the brain will perceive the muscle length, therefore elongating and improving flexibility. And as a result, if we improve and elongate the flexibility of a muscle, we start to see reductions in muscle tension, and again, reductions in pain, improved flexibility, improved balance, because again, those sensors within the joint capsules, within the muscles, are all feeding back information into the brain. So the point is if you want to have your spine cracked, I'll never forget the day that a patient came in and said, look, I just want you to turn me over and crack me like a glow stick. I will never forget the day that someone came in and said that. But also, I have patients that are 4 or below the age of 4 years old. And I also have patients that are over the age of 80. And the reality is I'm not going to be able to do the same sort of things with all of the spectrum of clients. Why? People have different tone, different needs, different levels of sensitivity, different bone densities, different joint flexibilities, and as a result, we may find that we have to do different types of techniques. So like I say, some of the ones that I offer in the clinic: activator, toggle, drop style adjustment, SOT or sacro-occipital technique, otherwise known as blocking, traction, activator technique. So we've got a multitude of different types of techniques. Manual adjusting. Look, I could go on for ages, but the point is that if you are scared or fearful of having an adjustment because you think that your chiropractor has to crack you, then you just need to have the conversation with them so that they can modify their techniques so that it suits your needs. That's the important thing, is change the adjustment, suit the patient, help them improve. Because at the end of the day, if a patient does not want to have manual adjustments, even if the chiropractor thinks it's the thing that needs to improve them, if a patient doesn't want it, they're not going to accept it, and as a result, they're never going to get better. And we as practitioners need to let go of our ego and be more mindful about the person that's in front of us. Truth. So we need to be more mindful about the person and not the technique. Mindful about the person, not the technique. You guys are coming here for help, therefore we have to listen to you, and as part of the process of getting you better, that is doing a practice or a therapy that is suitable for your needs and within your comfort zones. Because at the end of the day, you can force someone to do a technique, and the likelihood is they will stop and they will not get the benefits because they're not succeeding with the plan that you need for them to go through for them to actually improve in their health. Good morning, everyone. I'm sorry you just jumped on as I'm just about to finish. So I will see you guys in the clinic very, very soon. If you guys need any help with anything, obviously just leave us a comment below and I'll be happy to give you any answers on anything that you may need. They're the different types of adjustments we do in the clinic. So we'll speak to you again soon. Take care for now.